Good afternoon, and thank you for joining us here at 4:30. I'm Robert Hadlock.
And I'm Sydney Benter. With Halloween right around the corner, Austin public health leaders are making one last push, urging people to change their traditional plans.
They're also pointing to models suggesting that we control how bad this pandemic gets. KXAN's Tom Miller explains what has changed.
At this point last week, the COVID-19 model from the University of Texas was painting a dark picture for the weeks ahead, specifically around Thanksgiving. The situation has improved, though hospitalizations and ICU capacity is still expected to double by then. So what's behind this sudden change? It's what's happening now, with cases flat, hospitalizations, ICU patients, and ventilator use all dropped in the last week. However, health leaders are looking ahead to winter and want folks to prepare for other changes. They say we start getting symptoms of other things like allergies, and we need to make sure to get tested so that we can rule out COVID-19. They also hope that the winter weather means people will hunker down with their families and stop planning get-togethers. As for Halloween, they are still asking people not to have parties or trick-or-treat. The county's interim health authority, Dr. Mark Escott, showed off how he's going to be celebrating.
I'm happy to say that I have found a COVID-19 pinata that we're going to use for our kids on Halloween to change our traditions. We've never had one before, but this year, that's what we're going to do. And I suggest that others in the community change their traditions as well.
A team made up of public health staff, police officers, fire marshals, and code enforcement officers plan to be out on Halloween, responding to reports of parties. These health leaders know it's a big ask to change traditions, but we did a great job around the 4th of July and again on Labor Day. They're hoping to see the same thing again on Saturday, even under a full moon. Back to you.
Meanwhile, an update on the number of active coronavirus cases in the KXAN viewing area. As of news time at 4:30, there are now 929 cases in Travis County, 460 in Hays, 250 in Burnett County.